Hi, this is Shan Mantri. I'm a GP on the Bain CCG board and I'm clinical lead for the Map of Medicine project. In this video I'm going to talk about map referrals and explain how to access them and how to actually produce a form and where it gets saved in a clinical system. As you can see, I've got TPP already loaded. Now this is a dummy TPP site because I'm using my home PC and it's been currently given to me by Map Medicine and David Chan, who's one of their consultants. So at the top here, it's not my name, it's David's name. So when we do the form, you might see that his name might come up, even though it's me that's using it. So as you can see, I already have a patient loaded up. It's a dummy patient with an NHS number. There is an issue with using dummy patients normally on a practice system because the referrals doesn't allow you to go on if you don't have an NHS number. So that's why I've had to use this dummy system with this dummy patient that does have an NHS number, just to show you how it all flows. So here is my patient, and I've already have sidebar installed, and perhaps I have decided that I want to refer this patient for a DEXA scan. So what I would do is to go on directory, go to form directory and find DEXA scan. So I could even go down looking, but if I just type in DEXA, and here is the DEXA form, and what you then do is just click on it. Okay, so a Word form has now been produced. So if we go down here and click on it, let's minimize sidebar. And so now we have a form this is one of our DEXA forms. We've got patient's name, NHS number and address, referring doctor, and as I said before, because this is David's login, it's got his name here, but this is the address that I've put in, Disney World, and the number. And if we move slightly further down, these forms are the boxes that we can potentially tick, and it's pulled in any additional information, medications and so forth. So the system will allow you then to edit these forms and type in anything that you need to, and once you're done, kind of counterintuitively, you don't save, which is saving over here, you actually close it. Now the reason that this happens is that when the system first opens a form, it opens it in Microsoft Word, which is an external program, and it then needs to open it in integrated Word or internal Word for TPP. So you close this version of Word and you get this box, and if you've made a mistake and don't want to make the referral, you just do close form. However, if you do want to proceed, you click on Refer Now. I click on Refer Now. What then happens is that the form then gets loaded on internal Word or integrated Word. However, before that happens, you get shown this screen. So this is the screen that allows you to put in a read code. And for some of the forms, we have attached a read code already. So for example, for this DEXA scan, we've attached a read code here of referral for bone density scan. If there isn't a code attached, then you do need to put in a read code. It won't allow you to continue without putting a code in. So you press the R and put in a read code that's relevant to whatever referral you're making. Once that code is in place, you just click on OK and just say yes. And so now it opens integrated Word, where you will essentially see the same form. Now, I'm using a dummy System 1 system, so this is quite an old version, so what you would see would be a lot more different to what I'm seeing. You don't actually see this as a separate box, it will be at the top, but essentially the principle is the same, you see the same form, so you can actually edit at this point, although if you've completed it, you can then save it now. So what I would normally suggest to people is to click on the Save for Future Editing. All that simply means is the form's not locked, and it will allow someone else to go in afterwards to re-edit it. So it's normally worthwhile saving it for future editing. So if I click on that box, you get put back to System 1, and now if I go down to Referrals, which is down here, and click on when it was created, here we have the referral I've just done now on the 24th of February, referral for bone density scan. And so what this can be helpful for then is that if you are a clinician, you can maybe start the referral, save it for future editing, and then maybe come back to it, or perhaps ask an admin person to add in any extra content, or perhaps another clinician, maybe a locum or a registrar, could then add in their details if they wanted to. So let's just discard that. So let's save that one. So we'll say that we've done that form. So because it saves it in the patient record, there is obviously an audit trail now. So if we bring up Kelly Abbott again, it might take a few seconds to load. No, that's fine. And let's go to New Journal. And when we look at New Journal, we can see here, this is our referral that we've made. So there is a definite audit trail as to what referrals are made or not made. So let's now go back to the directory, or let's go back to sidebar. Let's load sidebar up in directory. Let's get rid of that and go back to the full form. So as you can see, we do have a number of forms here, and if you can supply us with a particular form that you require, we can put it on the system. The advantage of the system is that because we hold all the forms centrally and they're coded for centrally, is that you can always be sure that you've got the latest form. So if a form does get changed and we know about it, we can change it on the system and then you can access it. So as you can see, we have a number of forms here, and they are divided into different types. So these are all routine forms. If we sort of move down, we've got 2-week wait forms, so they're cancer forms, and then finally we've got the urgent forms as well, sort of down the bottom. And that, I would say, is probably the easiest way of accessing forms. There is actually another way of accessing forms, which can be helpful, is through sidebar, but not through the directory. So if I say typed in 2-week wait, because I know we've got some 2-week wait maps, sometimes what happens is that you get a little R next to the map. And what that R simply means is that we've attached a form or forms to that particular map. So we have a 2-week wait form, we have 2-week wait forms, but we also have a 2-week wait map. But attached to that 2-week wait map is all the 2-week wait forms. So if I was to click on the R, here we have all the 2-week wait forms. So all the forms that relate to that map are here. So for hematuria, say, I know that we've attached the urology 2-week wait form, so that'll be here. But we've also got a form for Emerson's Green, which is attached to that map, and so that would come up as well. So by clicking on the R, you won't necessarily come up with just one form. You may come up with several forms, but it's sometimes an easier way of accessing rather than going through the directory. So in a previous video, we've looked at back pain, and I know that we have a map attached to back pain, which is the form that goes to the pain clinic. So by clicking on the R, the back pain form comes up, but also we've got other forms where back pain has been found in these maps, so we've got other R's. You will also see the R on actual maps. So for example, here we have, and let me just shut that down, we have an R here, and by clicking on an R on a pathway will open the directory itself. Obviously that only works if you are using a practice computer which has sidebar installed. It won't work on a home PC or on an internet browser. So again, just another way of accessing the forms. We are trying to get to the point where a lot of the forms that we have are attached to a map, which allows this slightly easier, simpler way of accessing them. However, if you can't seem to access it this way, I would always suggest using directory and going to the form directory and actually just finding it that way. That's probably the simplest way of doing it, but perhaps not the most time efficient way. And that's really all I wanted to say about directory. Again, it's quite straightforward. It's not doing anything that your practice software perhaps used to do, but the advantage of the system is that it's all linked in together, and we can update it centrally, which again takes away the need for doing it locally, and with all the number of different practices that we have.